All right, chapter 13. Cold, heat, and hydrotherapies.
Yeah, mine was super long too.
All right, guys. There are 3 forms of hydrotherapy: the solid form, the liquid form, the vapor form. We're learning science. So hydrotherapy is the application of water in any of its 3 forms to the body for therapeutic purposes. Excuse me. The effects on the body. So a thermal effect is produced by water above or below the temperature of your body. So water that's not 98.6 degrees is what that means. This would be wraps, baths, hot or cold packs. So there's a mechanical effect and a chemical effect of hydrotherapy. Mechanical would be an effect that's produced by pressure exerted on the body. Mechanical is like a physical type effect. So this would be like floating. Buoyancy. Have anybody ever done the float spas?
Love those.
Yeah, those are cool. Until they leave you in there too long and you're like, am I done yet?
I also don't suggest doing any additional anything before you.
So, buoyancy offers a near gravity-free environment. That's why they say water therapy is really good for somebody recovering from an injury or a surgery, or older clients that are having an issue with weight bearing, or anybody having an issue with weight bearing. The body weighs 5% heavier than the same volume of water, they say. 5%. All right. So that's why we float. Chemical effects are produced by adding products to a bath or a steam. So this would be you adding your Epsom salts or your magnesium salts, essential oil, herbs, all that.
So technically, the floats would be a chemical then, because those suckers are loaded with Epsom.
It could be, yeah, you can have both mechanical and chemical effects going on. Yeah, it is loaded with salt, which is why you float. The solid would be, we'll say ice is a solid. Liquid would be the warm or the cold bath. Vapor would be your steam. Steamy hot Hades showers. Right, the skin is greatly influenced by skillfully applied water treatments. Water either transfers or absorbs heat from the body. So the greater the temperature difference, the more extreme the effect. Hopefully that makes sense. Has anybody done a cold plunge? Crazy people.
Cryotherapy.
I was getting some cryotherapy walking on the beach. Touch the water is cold right now, but it felt good on your sore feet. So normal would be your core temperature. Everybody fluctuates a little bit here. My normal temperature is like a 97.7. But they say the average is 96.8. Freezing would be 32 degrees Fahrenheit. Now, if we're talking Celsius, freezing is considered 0 degrees Celsius. So the freezing, we'll say cryotherapy, freezing point would be intolerable and dangerous if left for a long time. All right, so prolonged treatment. Cold, they would consider 56 to 70. That's uncomfortable, but it would be like a shorter session. I don't know what temperature like the cryopods and stuff get to, but I would say it's probably around the cold section. Cool would be 70 to 80. This can cause goosebumps. This is like when your pool is too cold and you go in the early season and you're like, it is only like 75 degrees. It's freezing. It feels cold. Tepid water or tepid liquids would be between 90 and 92. So this is just below the skin temperature. Comfortable would be 96 to 98. And then you have your hot, 99 to 104. This is tolerable. This is where hot tubs are usually at. They max out at 104. Then boiling is 212. We are not putting boiling water on anybody ever. Temperatures above 110 should not be used for hydrotherapy. I would keep it at about 104. So baths and hydro tubs should not exceed the 104 Fahrenheit. Effects and uses. So there's not going to be any thermal effect if your water temperature is the same as your body. You will get the mechanical effect of you having the non-weight bearing treatment. Short application of cold is usually 2 to 5 seconds. It has a stimulating effect. So that would be jumping into a cold lake or whatever quickly. All right. Extended cold is 10 to 30 minutes. This causes the metabolic activity to slow down. That's why they say usually if you're putting ice on, do about 10-15 minutes of ice. I've also learned recently, and I didn't know this, but extended cold, I forget at what point. We're going to learn about what cold does. But it vasoconstricts your blood vessels. An extended amount of cold actually reopens them back up. So it's almost like putting heat on, which I looked it up and the client was right. So I thought that was really cool. Thermal can have both direct local or reflex effects on the body. So you're going to have localized cooling, and then you're going to have reflexive effects happening within. Here's the difference between the two. Extreme temperatures should always be avoided or kept under close observation to avoid damaging your tissue, causing hyper or hypothermia. So I have kind of two tables, hot and cold, and the effects that is happening with the use of the hot or cold. So with heat, it causes vasodilation. So that is when your blood vessels open up, they're able to receive more things. It also increases your circulation. It relaxes the muscles. If you do a whole body application, like a tub of some sort, it increases your blood pressure a little bit. So people who have high blood pressure should be cautious with hydrotherapy that is hot. So it should be very limited time. And they should watch their any symptoms or whatnot. It increases the red and white blood cell count because of the increase of blood to the area and all that. It helps heal it. The local application causes an increased metabolic reaction, leukocyte migration, and an analgesic effect. Analgesic would be like a pain relieving effect. So when I say analgesic creams, I'm talking like Bengay, BioFreeze, Icy Hot, whatever. Cold temperatures. Vasoconstricts. The quick application is stimulating, but prolonged activity depresses or sedates the metabolic activity. Whole body application lowers your body temperature. That's why you're also not supposed to be in cold water for too long, because you could die. Hypothermia. Local application It reduces nerve sensitivity. In some people, it actually irritates things a little bit. So that person, they have to find what works best for them, hot or cold. Reduces that nerve sensitivity, reduces the circulation. Just think the skin surface is getting cold, so I always think of it this way. The blood is like going towards the center of your body, away from it. And then when that ice is off of that area, the blood is rushing back too. It's creating almost a pumping action when you're using the ice. I hope that makes sense. It reduces muscle spasms, but also it can stiffen your muscles and your tendons and ligaments. So that's why some people might feel stiff or more pain after ice because of that effect. It numbs. It has an analgesic effect, anesthetic effect as well. So if somebody is having inflammation, I tell them to go with the cold. Just think, if you have inflammation, you don't want to make it hotter, right? It's already hot and inflamed and irritated. So the ice is going to bring that inflammation down. Ice is good for acute injuries. But it can also be good for flare-ups. Like if you have tendonitis or bursitis, any itis, you want to throw the ice on the itis. Contraindications for any hydrotherapy, hot or cold, would be cardiac impairments, diabetes. I would say mainly because of the neuropathy that might be happening, especially, well, cold and hot. It might be too hot and they can't tell you that it's too hot. It might be too cold and they can't tell you it's too cold. Lung disease, kidney infection. You're not supposed to do anything with anybody with a kidney infection anyhow. If they have extreme high or low blood pressure. Now, if these things if they're medicated and these things are controlled, I would just be more cautious. Infectious skin disease, mainly because that's a communicable disease, right? Any open wounds, pregnancy, I'm going to circle back to that in a second, and circulatory issues. Warm and neutral temperatures are considered safe. So if anybody has any of these issues, you can kind of do a low-grade warmth, right, or a more of a neutral. For pregnancy, the reason why we are not doing the hydrotherapies is because you don't want to change their core temperature. So what I do is I lower my massage table heat. And you're not going to put them in a sauna. You're not going to put them in a hot bath for long. Mainly because of the core temperature thing. Questions yet? No? So there's different types of hydrotherapy. We're going to talk about cryotherapy. Cryotherapy is the application of cold agents for therapeutic purposes. This is used for pain, inflammation, swollen areas so we can bring that swelling down. After a cold application, the blood rushes to the areas to normalize the temperature. So this is that pumping action I was talking about. And there's one of these slides talks about contrast therapy. That's when you do both, hot and cold. Contrast therapy is like healing magic. It's awesome. So if you have an injury and you're trying to feel better quicker, hot and cold. I always end with cold to just bring that inflammation back down if the heat brought any inflammation. So the stages of cryotherapy would be, first you will feel cold with this cold application. Then things can start burning a little bit, aching, and then you get numbness. When stage 4 is achieved, you should stop the cold application. Does that make sense?
The cryotherapy I did was at Thrive and Wheeling, and it was like this thing, big chamber that you stood in.
Was your head out?
Oh no, I was trying to find the picture. My eyelashes were froze.
Was it like 3 minutes?
3.5 minutes, and it's 151 degrees below zero.
Ooh!
So, and honestly, like they pump music like heart go like, woo, you know.
You're like
and
trying to
then-
go boom,
yeah, and
boom,
you are,
boom,
you
like
can
you're
just,
at a
move
club.
around, dance, like just keep moving while you're in there. It was amazing. I honestly was like, I had actually gone over to float, but you can't float at certain times, and of course that was the day.
Yeah.
So I did cryo, I did red light therapy. I highly recommend the red light therapy.
Question, what does that do?
Red light therapy, it just, I honest to God don't know what it does, but that's on my list of things I want to add to my studio space.
Yeah.
someday. I just felt so good. Like you just.
It's
feel
like
it.
a far infrared, I believe.
Yeah, it's, it was a Juve
I know
light,
they have it in their tanning, with the blue light too.
but the.
Blue light special on
I
aisle
did
3.
The halo bed is, but the cryotherapy was really cool because I was really hesitant to do it.
I want one so bad, but they're really expensive. It's like
Yeah.
buying a really nice truck.
That's the way the Juve lights are, the red light therapy. But the cryo is really cool, and for 3.5 minutes, just to say you did it once, it's a really cool experience to do.
Let's go on a field trip.
Yes,
I
please.
just want an ice bath.
Well,
The cryo.
fill
is
your
right
bathtub
there.
with some ice.
I don't have one.
I don't
Oh,
have a bathtub either. It sucks.
Yeah, my wife likes baths when she can't get
baths are awesome.
I have a livestock trough that I keep on my patio.
That's a good idea.
Hubby put a drain on it for me, so it makes it easier.
Heck yeah, you can do an ice bath in there too. All right, you guys have heard of RICE, right? Rest, ice, compression, elevation. Well, they added a P to it, and that's protect. So you're protecting the area. I'm like, cool. So now it's price, but the same concept. After 48 to 72 hours or 2 to 3 days, once the swelling has subsided, you limit your massage there, or a limited massage can be proceeded. So once you bring that inflammation down, you can start doing massage to the area. It still might be super inflamed, and you might want to just work above and below it to get the blood flow moving. But at that stage, use your best judgment to decide whether you want to work on that person's body after an injury. Here's my contrast therapy. See, I jumped the gun. I get excited about contrast therapy. This is alternating the application of heat and cold for therapeutic benefits. Now, a lot of people will tell you all kinds of things. End with heat, end with ice. I say end with ice, but that's just the whole concept of you're adding heat to that inflamed area, and then you want to cool it back down. And then when the temperature increases back to a normalized temperature of that body part, that local part, then you'll, have that fresh blood flow. So if you think about it, the cold shoves it down, the blood and all that, right? The heat will bring things to the surface. So that's another reason why, I know I'm not like an esthetician, but that's why they say it is best to do your facial extractions or pop your pimples after a hot bath, because things are more open, the pores. Also, be careful if things are open after a hot bath when you put pain relieving creams on you, because the pores and everything are open, and it's going to feel really burny if it's a mentholated product. Also, be careful of mints when using it in a bathtub, because your whole body is going to feel like it is burning and on fire. So if you do any kind of mint in your tub, just a few drops, not 10, just a few drops is fine. Cold applications. So this is a really inexpensive, easy way, this picture, to do cryotherapy on a client. You fill a paper Dixie cup with ice, magically, with water, throw it in the freezer, and then when you're ready to use it, you can rip that top off so you have something to hold, and then you can use that ice literally and massage that area. The bad thing with this is, as it melts, they will be wet. So if you do this method, make sure you have an extra towel on hand. Say you're doing it to their knee or something like that. Put the towel under them. Do the cryotherapy massage with the ice on their knee or the area. Dry the knee and then remove that wet towel so that they now have the dry sheet still. So cold compresses, you can use a cold compress. So that's just a cold pack. I'm lying. It's not a cold pack. It's when you put cold water on a rag, we'll say. All right. And that should be refreshed every 2 to 5 minutes. So, you know, when you're a kid and you're sick, your mom gets a wet rag and sticks it on your forehead. That's the cold compress we're talking about. And it warms up very quickly. That's why they say to, you know, recool it or refresh it every 5 minutes or so. Ice packs. This can be chipped ice cubes in a Ziploc bag, or commercial ice packs. This says 30 minutes every 2 hours. I like the 15-minute rule, but you can do ice for a half hour. It's just you're really, really numb at that point. You can make a homemade ice pack. I've tried to do this, and I can't seem to make it work, but 4 parts water, 1 part alcohol, and it's supposed to make a moldable little Ziploc bag ice pack. Because,
Hair gel.
Hair gel?
If you freeze hair gel, something that doesn't fully freeze.
Yeah.
That's what we use for the track.
They probably do have an alcohol in it.
Yeah.
Because the alcohol won't freeze. You know how you can put your liquor in the freezer and it's awesome that way? That's because liquor doesn't freeze. Now, I don't know about like the lower grade. That's why you can't put wine in the freezer. It'll blow up. Ice massage. This is the Dixie cup. Fresh water in a paper cup, rip it, work on the area. They also make little plastic things you can get. It's the same thing without the Dixie cup, so it's reusable. You just sanitize it afterwards if you don't want the Dixie cup. They have compressor units, which are awesome. So when I was in PT, they have this wrap that they put around you, and this little machine, and what it does is it pumps really cool water through these coils where you're not getting wet, but you have that cryotherapy session. They're awesome. They have like cheap ones on Amazon. I thought about getting them because I have a closet, a whole section in my closet of pain relieving tools. I love it. And it's not because I'm in pain all the time. I like to feel good, right? Vasocoolant sprays. I have never used one of these in my life, but it is a cooling spray that you could spray on that area for your client, and it cools it down. Then you can perform massage therapy. Immersion baths, or the cold plunges. So they say if you do this, 60% water, 40% ice. That is so cold.
And women are not supposed to be as cold as men.
Really?
Mm-hmm.
Woo!
Yeah. It's like, I think it's like 8 degrees or 10 degrees warmer for women versus men.
I think
I don't remember the reasoning behind it, but I know I read that recently.
our temperature is just lower. Guys are always warm.
I don't think we have the same benefit as what
They
he
more
was
hemoglobin.
talking about.
They have more hemoglobin?
Like their levels are higher for men.
Maybe that's what.
Like a couple points even.
That's probably
Blood
it.
volume level.
Yeah, I feel like it was something to do with our, whatever, yeah, the benefit of it. So,
I need to look into that. That's cool.
yeah.
So I can.
Yeah, because I'm like, I could do it if
Educate.
it wasn't quite that cold.
Right? We're just sissies. No, I'm just kidding.
I want to go to one of those ice bars that you see. They're like everything's ice.
Oh, yeah.
They have those in
You
Vegas,
wear-
and
you
they
wear,
like.
the coat, like a fur coat.
Yeah.
That's probably what I would do for that type of therapy.
I found
Just take it
I
off.
found
Be like, give me a shot. No, I'm just kidding.
That's that contrast therapy one.
Yeah, the contrast therapy. So you had cryotherapy. Now we have thermotherapy. Thermo, warm. Cryo, cold. You're crying because you're cold. Jack, never let go. And thermal, just think of like a thermal blanket. So thermotherapy, thermal blanket. Warm and toasty. It's the external application of heat to the body for therapeutic purposes. So heat can be transferred in 4 ways: conduction, convection, radiation, and conversion. Some of these from the book make 0 sense to me, but I will explain them as best as I can. So conduction would be your heat pack or your immersion baths. All right. Convection would be your steam bath or your sauna. Just think of like an oven, like a convection oven. That's my best way to explain that. First one, it's conducting heat. Next one, convention, you're going into something, steam or a sauna. Radiation, the sun offers radiation, but we're also talking here about infrared radiation. Conversion would be your diathermy, I can't even pronounce that, ultrasonography. So we're not doing a lot of conversion thermotherapy, but has anyone had therapeutic ultrasound? No?
I think I have on my shoulders before.
It's
as a
nice.
chiropractor,
Yeah, so a lot of chiropractors or physical therapists will have it. And it's not an ultrasound that you're producing images with. You're using the ultrasonic waves to get blood flow and circulation to that area, and it's a very gentle healing treatment, except if you have a fracture. So if you have a fracture or some kind of break, right, a fracture in the bone, the vibrations I heard are painful. So immediate effects of heat. It draws the blood away from interior and brings it to the skin's surface. So you're bringing the heat to the area. That's why it's warm. Does that make sense? All right. The effects. Local application would cause vasodilation. So things are dilating, opening up. Receiving more blood. All right. Blood vessels and capillaries dilate. They increase your circulation and the oxygen absorption. So this is why you want to put the heat on, to get the fresh blood and oxygen to the area. It could reduce pain and stiffness. Think of a stiff joint that hasn't been being used, and then you add some warmth to it, and it's a little more elastic. So that's what's going on there. It's just very soothing. A lot of us go to heat first because it's soothing. It can increase your range of motion because it's warming up all those tendons and ligaments and muscles to get things moving. It softens the fascia. So think of the fascia as cold meat versus warm meat. So you have your, your steak where the fat is white and hardened, and then you grill that bad boy and it's soft and melty. So this is what heat does to connective tissue. Steak. Moist heat penetrates deeper into the muscles than dry heat. That's why you get your heating pads that come with that little insert that you can wet, and the heating pads themselves are kind of waterproof because the moist penetrates deeper. We're going to talk about some uses or equipment. Dry heat would be your heating pad without the wet insert. Infrared radiation. Diathermy, I actually put a thing here to tell me how to say it. Where's that on the other slide? This is oscillating electromagnetic fields. We're not normally doing this. I don't know much about it, honestly. And ultrasound. Diathermy and ultrasound therapy require the use of special equipment, and training is not typically within our scope of practice. Although, if you work for a chiropractor or a physical therapist and they train you in it, under the doctor's orders, you can perform these. Because I've been a chiropractic assistant before, so I was allowed to do these under the doctor's order, not under my LMT license. So as long as you have training to do it by an employer, you can perform these. Let's talk about moist heat. Moist. This would be a paraffin bath. So a paraffin bath is the paraffin wax. Have you seen the paraffin dips where you can put your hands or feet in it? I think I still have one. I may have given it away. I'll look. I'll have to bring it in for fun. So you would put your hands or feet in this paraffin wax. It's real warm at first, but it kind of keeps the heat in and it's very soothing. Also, the wax softens your skin. And a lot of them are scented, or you can get the unscented one. Peach tends to be a really popular one, and lavender. Rice packs is a moist heat. So rice packs you can make at home if you have a big enough sock, and you just put uncooked ice. Do not cook the rice. I mean, uncooked ice. Uncooked rice, don't cook it. You put it in a sock. A bigger, longer, or a tube sock is a better option. Then you tie the end, or you can be fancy and sew it if you want, like Hope. And pop that bad boy, depending on how big it is, in the microwave for a minute or two typically. And it creates a moist heat. These are awesome. And then after a while, it'll start smelling like burnt popcorn or something. And then you just can, if you make it at home, you can, empty it and put new rice, or you can just make a new one.
Or just add a little essential oil.
Essential oil. You can add herbs in these and essential oil a little bit to the rice, so it's already, we'll call it aromatic.
I should bring them in. I have rice eye masks that I use for restorative yoga. And
Yeah.
I put dried lavender in them.
It's a really common thing, the lavender.
It's really nice.
So,
I recommend putting them in the microwave with like a mug of water.
oh yeah, so it gets even more
That way your
liquid.
rice doesn't get burnt up.
Burnt rice. If you leave it too long, it'll burn
We've
too.
always had the rice back in. Put a cup of water in there with it. Let it go.
That's a good idea. I'm gonna
About
try
like-
that.
Like a mug, Put a
Yeah.
cup of water in there with it.
I always just like 30 seconds, flip it around, shake it out.
Yeah, you can
And I
shake
usually
it.
Put it for like 3.5 minutes with a mug of
Wow.
water.
Is it huge?
Oh yeah.
Yeah, so you might need to take it out halfway, shake it, see how it is, so you don't burn the rice. Some of it are like beans in there. There's different things. Flaxseed is a popular one because inside flaxseed, the seeds have a tiny, tiny little dot of oil in them. So you get more of that moist heat with the flax seeds. So this is all those options. You can just also buy them. Have you heard of Warmies? They make, so there's adult ones that are just the pack. But for kids, they're called Warmies, and it's stuffed animals that have the rice in it, and you warm it up in the microwave. So if they're sick or just want the comfort, they have the warm stuffed animal. They're cute. They're real cute. She's like, I'm going to look it up. Hot compresses. So this is soaked in water between 110 and 115 typically. And that hot, again, the hot compress will cool very quickly like the cold compress. Moist heat packs. So there's a thing called a hydroculator, which is that top picture. A lot of PTs or chiropractors will have this. So it's this warm bath that these moist heat packs kind of go into. And they feel so good. But typically you will have a protective cover over it because it's so hot. Hydroculator. There you go. I was like, how do I say it? And you get a really intense moist heat. You want to layer a bunch of towels in between that person so that they don't get wet. But those are nice. Body wraps is another form of moist heat. If you work at a higher end spa, a lot of these places will have the body wraps. You've heard of the body wraps, right? Usually there's herbs involved or a certain oil or essential oils. A lot of them have seaweed in them. So there's a bunch of different things. What you do is you put the stuff on the people and you put the warm wrap around them, and it keeps the heat in and helps them absorb whatever herb or oil that you put on their body a little bit better. Sometimes people will double this up with like a heating pad or a thermal blanket or a heated blanket to really lock in the heat. Showers and sprays. This would be your Vichy or your Swiss showers. Or they have some really fancy big city places have the massage table that kind of looks like this picture on the bottom. I'll zoom it. Where you lay on said table and you have the water spraying you like a water massage. Typically you'll have like a little towel over the private areas. I've not ever been to a spa that fancy that has like the Vici or the Swiss showers, but
It's probably about $100.
it probably is. It's probably awesome.
I think it'd be irritating.
Irritating?
Yeah, look at that table.
It'd be
Cold,
stiff.
hard table, and then just all these
You better
spritzers
see
at
it.
you.
It's probably like a marble slab with heat underneath of it.
I mean, probably, but like, just think how annoying it is raining outside. Walking in today, I'm like,
It's probably warm. I mean, it is warm. We're under moist heat.
I love a good shower.
Hot. Last but not least,
let me know how it is.
last but not least, we have immersion baths. So that is like going soaking in a hot bath. Different kinds of baths. They're all kinds. Look at this cool thing. So this is like a cryopod. So what you do is you sit in it. Your head is out so you're not claustrophobic. And then you have your hydrotherapy happening. I'm not going to go back over the temperatures again, but you have your cold, your cool, your tepid. Saline, which is a saline solution. Warm, hot. If they're in hot water, wrist pulse before. So they could keep an eye on their pulse. Offer water so they can hydrate. Or cool compress on their forehead. You could be fancy and offer that if you want. Or if you have a sauna, you can have a little mini fridge in that room and have cool towels in there for them if you want to be extra. I don't. It's something I should do because I am kind of extra. Then they have something called a sitz bath. So this is typically for people who are having issues in the nether regions. So this could be for hips or pelvis issues. It could be beneficial for kidney, bladder, or reproductive issues. So what it is it's a little bath just for your rear end, your pelvis area. This can help also for hemorrhoids and stuff like that. Whirlpool bath. This is water that's agitated. It's real ticked off. No, I'm just kidding. So agitated water is like your jets, so it's moving. Air bath is a steam sauna cabinet bath. So this picture is like a cabinet type situation. Steam canopies. There's a long list. We're not typically going to be doing any hydrotherapy other than hot or cold packs maybe on a client, or if you have a sauna. You might have a like a cold plunge or something like that, but typically we're not going to be doing that unless we have the space and the finances.
Dream big.
Dream big.
So question,